So a lot of you have been waiting for my story about labor and delivery. You're just sick. While I tell you the story, I'm going to flash up some pictures through my pregnancy so that you can relive it with me. Don't fret. This time there are some new pictures, so all of the old pictures are in black and white so that you can distinguish between when I'm in labor and when I'm pregnant. Not that I think you really needed the help there. We left off with me jumping up and down over a glass slide and then being sent home since the contractions weren't intense. It wasn't until the evening that we went in. So I think I was getting into my 36 hours of my water being broke. So you get set up, but before you can get checked on, before the doctors even come in, they need to get an IV in you. This is so that if they need to administer any kind of drugs, you're already pricked and they just insert it into the cord. 4 nurses and 4 pokes later, my poor arm was all busted up for the next 2 days. David was on my right side as they were poking my left side, holding my hand, and he was saying, "Oh my God, you're squeezing this hard. I'm screwed when the labor starts." And when the nurse laughed, because I didn't want to be mean, I didn't want to say it in front of them, because they were trying their best. It can't be that easy. I turned to David, I said, "David, look," and I held out my hand, and I was like, "Do you see what's going on over here?" He goes, "Jeez," he says, "no wonder." I said, "Yeah, it's not just getting an IV and I've been blown to bits." It was bad. I'm well on my way into labor at this point, and suddenly I have the strongest urge to pee. I'm staring at this bathroom that normally would have been seconds away, but with the contractions and the IV tree, it wasn't so quick. Throw in the river that I was suddenly gushing. Yeah, no. The nurse came in and she must have underestimated the amount of fluid I was losing, because she said, "Oh, just stick this pad between your legs and scuff over to the bathroom." Again, I thought, well, this is the first time I've done this, so maybe I'm being silly. Let me tell you, I wasn't. I moved my right leg off the bed to adjust myself to make room to slide the pad between my legs. The moment I moved that leg, water splashed out everywhere. Very Hollywood. I looked at the floor and I was like, how am I supposed to waddle to the bathroom now? Is someone going to build a bridge? But I tell you, nothing would stop me. Good Lord, did I have to pee. David had gone to get me a freezy, and the nurse said, "Oh, it's a good thing he gets you that freezy. Your urine tells me that you're hungry." During this entire endeavor, I have my cell phone active to update my Facebook and send text messages if I'm able to. I sent a text message to my friend saying, "Hey, my urine tells the doctor I'm hungry. Smart pee." It wasn't long after that first bathroom pee break that the contractions became more intense and more frequent, and eventually I found myself in a 20-minute contraction. They weren't so much painful as there wasn't any breaks. We didn't know it then why. We found out later it was because I was dilating ridiculously fast, but we'll get to that. For now, all I knew is that I've been timing these contractions using the big digital clock on the wall, because God knows that when you're in labor, you can't really figure out which is the minute and which is the hour hand, so they make it a huge digital clock. I knew I had to get neppy, because what we've learned during my pregnancy is if I go through pain, even just a headache, for a long period of time with no relief, I will vomit uncontrollably and crash. Well, there's usually only ever one on call, and he could be in surgery. You never know where they're going to be, so you want to call for it early. That way when it gets to you, it's either just in time or only a little too late. I couldn't sit or lay down because both were uncomfortable. They made the contractions painful. Standing was the only thing that made the contractions not so painful, but with the no break, you're getting so tired and your muscles are just crashing out on you, and David had to hold me up. Just as the doctor, the anesthesiologist, was arriving, I was being propped up on the bed so that I could arch my back for him to give me the epi, and the nurse asked me if I wanted to wait until the contraction was over. At this point, I can't even talk anymore because I'm focusing so much on trying to breathe through the contraction, that I just shook my head, because there was no way for me to tell her that there hadn't been a break for 20 minutes. There was no way I could wait for this to end. It may never end. They were just so close together. I looked at David to answer any questions that the anesthesiologist had because I couldn't talk. And then the vomiting started. When the epi was finally completed, Genevieve's heart rate had dropped and there was
cause for concern. They had me on my side facing David, so I'm on my right side facing David. I was losing oxygen, so they put me on an oxygen mask. They were monitoring her heart rate, and then the shakes started. I started shaking violently, uncontrollably, couldn't stop. My teeth were chattering underneath the oxygen mask. And all the while, I can't really tell David that I'm really doing okay. As much as my body was out of control, I was freezing even though I had a fever. My body was just crashing because it had gone so long with a contraction with no breaks. Arm that had the IV tree and the epi in it was freezing, so eventually I was able to word that my right arm was freezing, and with all the cords on it, I couldn't put it underneath the blankets. They piled a bunch of blankets on me to try to warm me up, but they had to keep monitoring my temperature because I had a fever now. When they're monitoring my temperature, the nurse put the thermometer in my ear. I'm lying on my right ear. She puts the thermometer in my left ear and then asks me a question. And of course, I've still got the oxygen mask on, so I'm kind of like, In the end, I was fine. I just couldn't express it. And even if I could, I don't think it would have been that believable through chattering teeth behind an oxygen mask. So I just focused on coming back. Eventually, I was strong enough to muster a thumbs up. And when I could speak without my teeth chattering, I explained to him what I had been going through previously. And I think that made him feel a little better. Before long, I felt the strongest urge to pee. What we can do is give you the squat test, which is exactly as it sounds. You stand up, you squat. If you can squat, they let you walk. If you can't, you lay back down and they say, "Are you sure you don't want the catheter?" So, David on one side of me, nurse on the other, I squatted like nobody's business and made my way to the bathroom. Humorous, however, was the fact that I had no muscle in my left leg at this point, so I was walking very much like a drunk snake. If a snake could walk vertically. 4 hours since my labor started, I felt like I needed to push. And she looked at the clock and she said, sadly, "Well, it's only been 4 hours, but if you still feel that way in the next contraction, I can check you." Well, next contraction, yeah, I still need to push. So she reminded me, this is your first child, so it's probably just the pressure, extra pressure on your pelvis. So she checked me, eyes open wide, and said, "I'm going to go page a doctor." So after 4 hours of labor, Genevieve was on the way. And it wasn't long after that, 12:40 in the morning, May 30th, we had our baby girl.
This has been a bwings production.
Hey, Genevieve.
Oh, she's gonna tremble again. Oh, it's okay.
Time to push.
Oh, I have to push, then turn off the camera. I'm pushing. Yes, no?